Good morning, Dr. Shaw. You advertise with us, and you make sure that women get breasts, don't you?
I know. How are you?
Good morning, Dr. Shaw.
What a very important
Good morning. I
public
was driving
service
into
you
work, and I
provide.
was listening to you guys talk about this, and I wanted to tell you the official plastic surgery opinion about doing breast augmentation on people that are 16 years old.
Okay.
Okay, let's have it.
We don't do it. Unless you have a severe breast deformity, really you can't even step into our office until you're at least 18. And if you're 18, we still highly discourage it unless you're with your mom and your parents and you've had some counseling with your parents about it. And then usually we like to wait until you're at least 20, 21 when you can make a good informed decision about it. The 18 years old girls that come into our office with their parents, usually it's a severe psychological concern to them. They're in athletics, they're in sports, they've been teased, and then we really kind of work with them. But if you're 16, you're not done growing, you shouldn't even think about doing a breast augmentation.
So is that standard for most plastic surgeons? Because obviously Rick told the story about this young woman who at 20 got her breasts done. So
Right.
That's not really standard, is it? Your rules.
It's not standard, but the American Society of Plastic Surgery, we talk about this a lot, and we try to do what's safe. I mean, we have dentists doing breast augmentations now, so you got to watch out who you go to and make sure you get a good opinion.
Yeah, they're giving them out of the backseat
we
of
see all
cars.
sorts of stuff nowadays.
Yikes.
Hey, let me ask you this: have you had 16-year-old girls come in wanting breast jobs?
With their parents?
No, not really. Our patient coordinators are pretty good at screening that out on the initial phone call. We usually tell them to wait, and if they're 18 and they're there with their parents, we'll have them. We'll have a nice long talk about it. But 16-year-olds, it's really hard to even just let them even come to the office to talk about it. You're not done growing yet, and plus you can't make a good decision. You're too young.
What about a nose job at 16?
Noses are a little bit different story. If it's a severe problem that needs to be fixed as a source of psychological concern and a lot of teasing at school, then we'll talk about it. If they're just trying to look like, Ashley Simpson or something at 16, we still highly discourage it until you're at least in your late teens or early 20s.
So your body's still growing. And Dr. Shaw, just what about, we also talked about lipo and those kinds of things at this age. So pretty much across the board, you feel the same way about all plastic surgery for people who are that age?
Yeah, when you're in your high school years, especially when you're 16, 15 years old, you're still growing. Even having surgery, your body still has growth hormones and healing hormones that will cause you to overheal and scar, and you don't want to risk those types of things at that age. So really, it's a good idea to wait. If you need liposuction at 16, really, you still should have a really good metabolism. You should be going to the gym and working out and trying to do it by putting some work into it first.
Hey, let me ask you this real quick, and we'll let you go because we have some people on the line who have had experiences with breast augmentation. Regardless of the age, do you ever come into contact with ladies who regret their breast implants after they have them the same way you would regret, like, a bad tattoo?
I've probably done about 3,000 breast augmentations, and I haven't had one lady come back and say, take these things out of me. But, I'm sure it happens. You really got to make sure that when you do a breast augmentation, you have realistic expectations, and you're doing, and you're not choosing something that's kind of ridiculous. We try to encourage women to choose a natural size, or you can even go bigger if you want, but not triple F.
Right.
Would be Pamela Anderson.
Yeah.
Then you're going to regret it.
Well, how many times, Dr. Shaw, have you fixed other people's plastic surgery or breast augmentations? How many times? I mean, lots, right? Would you say 30% of your work, 22% of your work?
Yeah, I would say about 30% of my work is fixing people that go and get these gigantic 700cc implants and need to have them removed and their breasts lifted, and just people that have made bad decisions and no one really talked to them about what decisions they were making, and then we end up fixing it. It's I would say I see at least 2 or 3 people a day that come to my office that need to be fixed.
Well, Dr. Shaw, I'm going to give you a second. Go ahead. Plug your phone number.
Thank you. 327-3800 is our phone number, and if you have any questions, you could definitely give us a call anytime. We love answering questions.
If you ever need an intern down there at the shop, I'm free after 9, and I would love to learn at the foot of the master.
Well, Dr. Shaw, thank you so much for listening to the show and taking the time to give us a call. We appreciate it.
You're so welcome. Thank you for educating the public out there. I think it's really important that you guys are talking about this. We're seeing a lot of ridiculous stuff going on out there, and we really want to make people realize where to go to make good decisions.
Wow.
Thanks, Dr. Shaw.
We're making a
You take care.
positive impact on society, according to a doctor.
I know. Is that
what were
awesome
the chances?
or what?